Hello, everyone, and welcome to our panel, Rural Health Innovation in the KFLA Region, Opportunities and Challenges. The purpose of today's panel is to gather students and community members from the KFLA region, including entrepreneurs, innovators, and healthcare leaders. It's also to provide education about rural health and where there is room to pilot innovation across the region. So this panel event is kicking off our rural health programming as part of the health innovation stream at the Dunin-Deshpande Queen's Innovation Center. So health innovation supports teams who want to develop and deliver new or improved health policies, systems, products, and technologies, and services and delivery methods to improve people's health. So in an effort to better capture the whole of the KFLA region, we're expanding our programming and narrowing in on that specific region. So the last item I'll mention is please keep your mics muted throughout the duration of the panel event, and feel free to put any of your questions in the chat throughout the panel. You can also use the raise hand feature or engage with the panelists in the Q&A section at the end. So without further ado, I'll pass it off to my colleague Bruna, who will introduce today's moderator.
Thanks, Megan. So to moderate this panel, we have Tracy Snow. She was recently appointed as the Rural Economic and Community Development Manager for the City of Kingston, responsible for overseeing all city-led rural economic development initiatives. So take it away, Tracy.
Good morning, everyone. Thank you so much for attending, and thank you so much to the DDQIC team for facilitating this and putting it all together. I feel very lucky to be moderating this today and facilitating the panel. I do have a background in rural economic development for many, many years, also in health, have been part of hospital systems and work in rural health community partnerships for quite a long time. So I'm excited to be part of this. And we have some great people on the panel. I'll introduce you to them. First, we have Claire Bouvier. Claire is the coordinator of the Rural Mentorship Program. She's a small business advisor for the Kingston Economic Development Team and a founder of Feist. We have Louise Moody, the executive director of the Rural Frontenac and Community Services Group. We have Gary Oosteroff, Countryside District Councillor for the City of Kingston. And we have Meredith Pricker, nurse lead at the Rural Kingston Family Health Organization. Today's event is really to talk about a number of things and bring some key ideas from these panelists on how we can look at gaps and opportunities in rural health and work together collaboratively moving forward on some opportunities that we can help satisfy some of those demands and those needs. We want to learn about the current rural health care environment. We're going to talk about that, innovation priorities, challenges in rural health, and problems that remain to be solved. We want to hear from you. So we're looking for your questions and ideas. As Megan had said at the beginning, just please use the chat function, and then they're going to let us know what those questions and comments are during the event. If we cannot get to everyone's questions, we are going to address them after this and then put together a report as well so that you'll have some of those answers done. If you also feel that some of those answers still need to be addressed, you can reach out to any of us as well for further connection. We also want to make sure that we're all staying connected, and this is a really great way to have our attendees involved and our panelists working together and moving forward, especially with the DDQIC team, and looking at opportunities in rural health. And my main focus with this new role under the Rural Kingston strategy is to support rural development in every aspect, from health, workforce development, farming, ag, and rural businesses. So I guess to start off the event, we'd like to talk about really and look at some of the topics that we're going to bring up in some of the conversations. How do we define rural? And we'll bring that into the talk during the session. And how do we define rural health? My introductory question, I guess, to the panel, once they introduce themselves and talk about some of the pieces and the experience that they have, is kind of what is the biggest challenge in rural health at the moment? And during the conversation at the end of this event for the last 30 to 45 minutes, we'll be able to talk about that question and then come back to those leading questions about defining what rural health is and how we can support it. So let me introduce Claire Bouvier. Claire, please go ahead.
Hello, everyone. Again, just echoing Tracy, thank you to DDQIC for putting this event together. I think it's amazing that we can start the conversation and start creating solutions on providing for rural, especially in health industries. So as Tracy said, my name's Claire Bouvier. I've been very fortunate for the last couple of years. I've worked with the Kingston Economic Development Corporation as one of their small business advisors. I also saw many years ago when I was a teacher the need for rural support, and I started FICE Studio, which stands for Female Entrepreneurs in Small Towns, and very dedicated to working with female entrepreneurs and supporting them from anything within the rural to try and help them become successful entrepreneurs where they have chosen to live in. I'm also been very lucky. It's been amazing. The last couple of years, I've been able to be one of the facilitators for the Rural Mentorship Program with Queen's University, Kingston Economic Development Corporation, and with our federal government, providing support for rural entrepreneurs across the Kingston and surrounding areas. And that's where I'm going to really focus. That's been something that I've really had an amazing opportunity to work with a lot of rural entrepreneurs in the health space. So that will be the insights that I share today. So thanks again, Tracy.
So Claire, we'd like you to spend a few minutes just to talk about some of those top insights and observed challenges with rural health founders. One of the things to the attendees, the group at DDQIC had actually had individual meetings with all of us prior to this and kind of looked at what our thoughts, beliefs, understandings were in terms of gaps and opportunities in rural health. And so each of the panelists are going to have a few minutes just to talk about their top 2 or 3 insights. And then from that, we're going to wrap that up into some conversation and get into that a little bit deeper. Go ahead.
Awesome. So again, just to reiterate, this is from my perspective, working with the entrepreneurs that I've had the chance to, and I would say there's lots of obstacles and challenges. The 3 top ones that I've kind of identified over the last several years working with rural entrepreneurs in the health space is the lack of marketing and sales, whether it's skills or the actual having availabilities, looking at balancing profitability with compassion and isolation, access, lack of network. So to go a little deeper, the lack of marketing and sales, whether it's skills or the availability, first of all, and the most obvious is the lack of infrastructure that's provided for our rural practitioners, whether they're independent and we're talking infrastructure from anything from financial services to communication services, specifically cell phone coverage, internet availability. And it's been really interesting because we think we live in a world now, it's ideal, everything's online. It seems really exciting because these individuals that are providing services and products from rural communities, it's less travel for them. But what I've noticed is so from a personal experience, we've hired a couple of individuals to provide services. I hired someone to do something and they are fantastic. And I got to work with them in the offline world pre-pandemic. And then we entered the pandemic and we think the online world is going to be fantastic. And because of high winds, we were unfortunately not allowed to, the internet wasn't allowing us to do the service, so we had to cancel. And that's really limiting for marketing, selling your product. That's a huge one. I don't have much time, but I think the biggest one I do want is, I know we'll talk about a lack of network and isolation is an obvious one, but the biggest one is balancing profitability with compassion. Health practitioners go in, it's a vocation. It's not always a career to make lots of money. And so I'm constantly stressing we need to look at profitability auditing. And so that's a huge one, especially rural entrepreneurs always feeling apologetic that they're in rural settings providing their services, and we have to change that narrative. So I could talk a lot more about this, but I know we have a tight schedule and I love it. So I'll pass it off back to you, Tracy. Thank you.
Thank you, Claire. That was great. And yes, we'll absolutely touch on some of those pieces in our thorough discussion later on in the event. So the next person I'd like to introduce is Louise Moody. and she can introduce herself. She's the Executive Director of the Rural Frontenac Community Services, and we'll talk about her insights as well. Good morning.
Good morning. Thank you, Tracy, and welcome everybody. So I'm pleased to be here. I'm talking to you from Charlotte Lake, so I guess the rural lens that I bring is looking down to Kingston, and everything seems downhill from here, but I have to say that there's another hour north of here if you want to include all of Frontenac County. So just bringing that insight that we're a really vast area, and the more we can include everybody, the better we are. If you look at the agency I worked for, we started in 1975, and it really was, Charlotte Lake was a little bit at the end of the road, and it was our local doctor who said there needed to be services, and it was Rural Frontenac was birthed with much community development and evolution. But we're here today. We provide rural transportation, we provide healthcare, we have a licensed daycare in Charlotte Lake. So we bring a lot of services with us. We also partner with a lot of agencies. So Ontario Works, the Legal Clinic, ODSP, Child Welfare, all have offices up here. So we can have rural workers up here and employ local people to serve our local community. Tracy, do you want me to jump into the insights?
Yes, please.
Okay, so I identified 3 key insights that I have found. So I'm somewhat new to the area, certainly not born and raised here, which many people are. But my insights are the challenge of geography, kind of the social challenges that exist uniquely to a rural community. And lastly, we're adaptive and resourceful. That's how people, since pioneer days, have survived in rural communities. So the first one is just population density. And I think Claire brought that up, but it fits really well. The density up here is 8 people per square kilometer. That's across the entire county. If you go up to North Frontenac, it's only 1.3. So you're not walking to your neighbors easily. The comparison is Kingston is 82 people per square kilometer. So you can see a real distance. And hi to Ampa. I see that someone's joining us. So that's well north of me. So distance becomes the barrier to access services. We don't have buses. We don't have taxis. There is just no public transit for people to be able to use. Winter driving, we all know that everything got shut down on Monday. Rurally, it's pretty clear it's shut down. We're pretty used to it, but limits access. People who drive from the city up are more limited. They're not as used to the city driving. We have few grocery stores and retail outlets. So access to food is limited and there's fewer options. So the great thing is we can have gardens and hunt and fish, but there's not the same options that you'd have in an urban community. And as Claire has said, and we all will say, is digital access is definitely limited. And also digital literacy. So it's not just that you don't have it, you may not have learned to use it. The social challenges, poverty is real. We do have homelessness. It's hidden. It doesn't look like a shelter on the street, but people live in unheated buildings without access to water. And it's a delivery challenge and a health issue. We also have a lot of old housing stock and very limited social housing. So if you are homeless up here, you need to go to Kingston, and that's a barrier for people who are very used to an urban lifestyle. But we're also really adaptive and we're resources. So agencies like my own partner agency in South Frontenac and Sydenham, there's an agency up in Northbrook. So there are innovative hubs that have been created to serve social services. Family health teams have created hubs. Charlotte Lake is a real leader in healthcare, and services are mobile. We try to go out to the hamlets and the villages to deliver in those communities rather than expect people even to get to Charlotte Lake or to Ampa. We want to bring the services out there. And we actually have a unique local newspaper. So talking about marketing, Frontenac News has been around. It was actually founded by our agency and still exists. And if you want to find out who's having a birthday and who's turning 107, just open our newspaper up. So it's a great resource and a tool. So thank you, Tracy.
That's fantastic. And so to our attendees, we had the group had many conversations, like I had said earlier in the past. And the purpose of the event today, in terms of talking about rural health and looking for opportunities and ways that we can work together to support rural health, has no inclination or any negativity towards all of the incredible things that are happening in the city of Kingston with their existing health groups. they're doing fantastic. What we're looking at is just challenges and opportunities for people in rural communities that cannot access those services from the city of Kingston, that still need those services, cannot either live in Kingston, move to Kingston, drive to Kingston. So it's really, you know, again, not discounting all of the incredible things that we have at the city of Kingston and all of the wonderful health services we have there. We're just trying to see how we can look towards, you know, spreading that out and supporting our rural communities so that everybody gets access to the healthcare that they need. So next is Gary Oosteroff, and Gary is our counselor for the Countryside District for the City of Kingston. And I'll let Gary introduce himself and talk about his insights.
Yeah, hi, Tracy, and good morning, everybody. I'm delighted to be here. I do want to thank DDQIC as well. I'm getting to know them, and it's been fun to prepare a little bit for this and just to be part of it. I have been the rural counselor for the City of Kingston. There's some noise there. And since 2017, and it's been a great learning experience for me. I'm born and raised a rural son of a farmer, and you can be in the boardroom or in the barnyard, but I live in Glen Burnie with my family here, and it's interesting for me. I've always had a rural lens, but it's been really fun for me to share that with an urban. I say that we're an urban-centric municipality, really, and I think most of people would agree with that when you live in the country. But for me, you know, this rural area that I am in, it's kind of the gateway to the real rural area where Louise is up there, and to the north, all the land that we love to the north of us. Because we talked about what is rural. In some ways, my district is kind of got split personality. We love the rural area, and we love living here, and everything that is quintessential to being in the rural area, or, you know, your autonomy. And but we are privileged to live in a municipality like Kingston. It is 25 kilometers in every direction but south from my home, so I do have a very large area. I go to Gananoque border, I go up to Sealy's Bay, and all the way out to Loyalist. So you can see that, and north to South Frontenac, which is only a few kilometers, but you can kind of see how my area is large, but we have that connection to the rural area, the outlying areas of Eastern Ontario, but also that we're connected to the city. And the city has, you know, our hospitals. I've had tours. We have a fantastic system that way of connection. So many of my residents and constituents work in the city. So there's a closer tie that I really acknowledge this morning as well. But I have certainly the health component for me is. Probably it's a really important file, but I would say because of our proximity, it's not an acute file. It's not something that I hear from every day from my constituents, and so that's why this event today is so interesting to me, because I want to know what's happening in the north, and I want to know what we can learn together. And so I'll be learning a lot, and I can certainly go into. Tracy, right now, the obstacles that I see. Is that a good time to do that, Tracy?
Can we bring that in our discussion in the 40 minutes that we're going back and forth in terms of the obstacles? Because it'd be a great place to put the gaps and opportunities piece. Would that be okay with you?
Yeah, because I wanted, I thought that's what everyone was doing right now, but that's just
no, just to talk. We were just highlighting your insights in terms of where you think those key pieces are. If there's anything else, please go ahead and bring it up.
No, okay. So, you know, in this area, in the connections that we have, and I will probably go at length on that, but it's such a privilege to work with people like, I'm going to be working with Tracy closely now with economic development. You know, we have evolving transportation issues and solutions on the horizon, and economic development is also something that we are focusing on. And then one of the things that I've really noticed in the 3 campaigns I've actually been in now is the aging at home. And so I see that as being kind of a new not obstacle, but a new concern that I've shared with different levels of government. And, we have a bit of a housing crisis. And so that's something that I'm going to talk about later as well, because more and more people are choosing to stay at home or having to stay at home in the rural area. And I am concerned, obviously we all are, for their well-being. So those are areas that I will delve into later, and I look forward to joining in the conversation. Thank you.
Thank you, Gary. And it's interesting because the way you define housing is, so there's a different definition you're calling it, and there's multiple ways to look at it, aging at home, where Louise had also talked about kind of lack of housing and lack of opportunity. So the aging, they all really mean the same. Aging at home, you may have a home, but you still don't have the services. Where say far north, you may not have a home or a part of a home that is healthy to live in and still don't have the services. So again, it's just, how do we get those services out to people who want to stay in their home, who need home? Like it's all kind of, I love how all of your experiences are all wrapping together and very aligned.
Yes.
Thank you, Gary. So the next, our last panelist is Meredith Cricker, and she is our nurse lead at Sydenham's Clinic, Rural Kingston Family Health Organization. And Meredith, I'll let you talk about your top insights and your experience.
Hi, I just wanted to say thank you to the DDQIC for including me in this. I currently work at the Sydenham Medical Clinic, and I've been there as a full-time chronic disease management nurse for approximately 6 years. Part of my role while I'm there is to help keep people in their home as long as possible. I help connect individuals to community resources. So I am there full time, and I work very hard to try to keep people in their home rurally. So because we're doing this rurally, it does present a number of challenges. So I just want to start off by saying that the Frontenac County, with its 4 municipalities of North Frontenac, Central Frontenac, South Frontenac, and the Frontenac Islands, have a combined area of almost 4,000 square kilometers. So this can present some challenges providing healthcare to individuals in the rural areas. So my lens today is specifically because what I know is the Sydenham rural area. So I'm looking at about 20 to 30 minutes north of Kingston. So one challenge that for us can be our access to resources. We are experiencing an ongoing shortage of community nurses and PSWs. There are long wait times, and in some cases, there are no PSWs or nurses to see individuals in our rural areas. A couple of obstacles that I've been made aware of are long driving distances between clients, and when they're using their own vehicles, both of these make working in the community out here in the rural area less attractive for some. We do have some excellent resources within our rural community out here. A couple of examples are the South Frontenac Community Services. They offer a couple of examples are the Adult Day Program, Hospice, Meals on Wheels, and Transportation, and that's just to name a few. We also have mental health services and youth supports that are available out here, for example, the Maltby Center. And for patients that are specifically attached to the Rural Kingston Family Health Organization, we now have access to our interprofessional care team. And that consists of a social worker, practical assistance worker, a dietitian, respiratory therapist, and kinesiologist. But being rural, we do still have ongoing challenges, even though we do have some of these excellent resources. We have access issues, and we have long wait times, transportation, and above all else, we do have some issues with awareness that the programs are out there. Transportation services do exist for us, but there is a cost attached. Some of it is subsidized through ODSP or OW or Veterans Affairs, but for some, the cost is still not covered, and it can be a barrier for using these services. Another challenge is housing. It's an issue that we're facing out here. We need supportive housing. The demand for supportive housing is greater than the supply, and we're experiencing very long wait lists, and people are struggling to find suitable housing or supports in the interim. Individuals then end up living in environments that are not suitable for their health conditions, and it's impacting their overall health and physical well-being. We have an aging population in the rural areas, and we do not have enough seniors housing to address this issue. In 2016, the census showed that on average, 16% of owner households spent more than 30% of their income on housing, and 50.3% of tenant households spent more than 30% of their income on housing. These figures were captured before the current housing boom. So currently individuals have less income to spend on maintenance and repairs, and their housing greatly impacts their individual's health. And inappropriate housing or housing in need of repairs and maintenance can affect their health and outcomes. So in regards to issues of unattached patients and shortages of physicians, that was another one I was asked to address. In 2009, the Southeast LHIN reported that it's estimated that an unattached patient rate was 7.9%. They did note at that time, though, that recent trends were suggesting that more residents were able to access primary health care providers through new initiatives offered by the Ministry of Health and Long-Term Care and the Southeast LHIN, but we're still noticing that there are unattached patients in our rural areas. And Kingston is also experiencing a shortage of doctors with as many as 29,000 unattached patients. The need to recruit more physicians has been recognized, but this continues to be an ongoing issue. Sorry.
Can everybody hear me okay? I'm having some problems. Sorry, just one second. Can everybody hear me okay?
Yes, we can.
Okay, sorry. My screen's not working for some reason. Thank you very much. We appreciate your insight, Meredith. And I really like actually how you bring up the unattached patients. It's a really neat way to put it, and it happens everywhere, but boy, is it prevalent in rural communities. So we've heard a little bit from our four panelists in terms of their insights and concerns and things that they see need to be addressed and discussed. And we're so glad to have them together today. I'm going to be bringing up a number of questions to start conversations with the team. If there's any point the attendees want to ask a question while we're having some conversations over the next hour, then please do through the chat, and the DDQIC team will get those to me. So first question is, communication actually seemed to be brought up a few times with a number of you. What are ways that we can actually improve rural health through communication? Understanding our current existing resources that are available, but then looking at what are the resources that we need to be addressing so that we can down the road look at programs and opportunities, partnerships to solve those problems. So let's talk about communication. You've touched upon it, most of you. What are the existing challenges, and then how can we, look at ways to solve those challenges? We'll give about 5 minutes for each question, and I'll let somebody go ahead, please.
I'm happy to contribute. I have to say that COVID and virtual has really made access incredibly huge to anybody who has the ability to connect virtually. So it's been a huge benefit. There's been some innovation since COVID to increase access. So we know the schools have done a lot of work to both address digital literacy and teach the kids how to use it, and address some gaps. So students were given cell phones to be able to access services if there was cell service. We have tablets now. We have some funding through the Ministry of Health for virtual health, and we have tablets we could loan to seniors or people who want to access their doctor or family. So that's available. Connections is a literacy program up here, and they will do digital literacy with people. So if we give a senior a tablet and they don't know how to turn it on or access Wi-Fi, they can. Kingston Frontenac Public Libraries turned all of their Wi-Fi out to the street during COVID, so that if you couldn't go into the library, you could park outside, and you'll often see people parked outside a rural library using their Wi-Fi, which is, I think, really important. And through a Children and Youth Services Planning Table, we had some funding for rural transportation. And during COVID, we weren't talking about driving people. So we focused more on digital access to Wi-Fi. And we put some boosters on quite a few public buildings. North Frontenac Township has one, and more boosters so that the people that have high-speed internet to be able to broadcast it would be a huge asset. So those were strategies we took to certainly digitally to be able to increase it, but it has moved light years ahead in the last 2 years.
Well, Louise, it's refreshing to hear all of the positive things that you have done in your area. And, as much as we know, COVID has had such a detrimental effect on all of us in every way possible. there have been some real positive things, especially with communication and forcing all of us to be more digital and understanding digital, how to use it, and taking care of our broadband expansion opportunities. So yeah, thank you, Louise. Those were great points. Anybody else want to look into that question? We still have a few more minutes on that one.
Tracy, I could just add that there's EORN, and I don't know very much about it, but Gary might, but that might just be worth adding to the conversation, because it is a broader political conversation with all of the municipalities.
Gary, did you want to talk about that, or?
Yeah, thank you. Sorry, doorbell just went. Really, really relevant things. I mean, when I think about when I first came as a counselor in 2017, I think one of the first files that I built on was broadband in the rural area, and it's been I think we're on the edge. So when you talk about how far we've come in the 5-6 years, right now we're just about to announce a major company is coming as an internet service provider for the area, and I'm very excited about that. But we've had to do so much work. There's been so many communities that have been so frustrated. I mean, we're very fortunate that here in Glen Burnie, for example, there are pockets where people have fiber to the premises, but there is still significant area between here and Gananoque Way along the river that don't have it, and are quite impacted. When you think about education, I mean, I've had parents in tears. 3 kids home, and one of the parents home, they're all trying to use the internet, and it simply is overloaded, the towers and that. And so we're talking about everything that a family does is our doctors are calling us now. I can share, I've literally had a call to the doctor here, and they literally are able to examine a cut on your children's fingers, through the internet. And so everything is very connected to that. But so for me, the broadband file, I'm excited about how it's moved along, provincially and federally. I really think that we need to pressure the governments further. Than I think that they have not untangled the regulatory knots that are still there, that are holding back full evolution of broadband. And it's unacceptable. And I don't think we have anybody else from the government levels, but they really need there's too much talk at the provincial and the federal, and not enough actual action to get that done. And I don't want to get into politics, but it does play a difference. And I know that we are municipally, and with people that are here, the solutions that we have come up with, like Louise, all the towns and all the efforts has really been amazing. But it would have been a whole lot easier if we had just had support from the other levels of government and allocating funds properly. And I know that that's a concern, but I am excited to say that we are very close. Claire might know a little bit about it, and I think Tracy knows, but I'm not sure I can talk about it completely, but we are hoping to have an announcement within the next month of a major connection, a major national firm will be bringing broadband to every house, I believe.
Thank you. Yes, that is actually the case. And we can't really get into it at this point, but we know that the province and Eastern Ontario Regional Network are working really closely to make that happen, especially in the Kingston, Frontenac, Lennox, Lantern area. So we're hoping to hear something, fairly soon that we could be announcing. So on the communication piece, any other last comments from our panel before I go to the next question? And again, we still have more time after to be kind of pulling all of this together. So the next question I wanted to ask the panel to maybe have a quick discussion on is, and this is a big one, and this one we could talk days for. How does transportation intersect with rural health needs and gaps? So how does transportation priority, lack of, have that effect on rural health? Anybody want to talk about that, please?
I don't mind just starting briefly because it kind of comes out from here, and I can just share. We have transit in the urban area south of the 401, and from the very beginning, that's another file that we've knocked on the door of the transit department, and we have a connection now with Amherst View where it's grown, And I can say that in 2022, through considerable conversations and a plan, we're going to be doing a pilot into the rural area, and so of transit routes. And the reason I wanted to bring that up was that's a success. We've come a long way, but I think what we need to recognize is there's been an evolution in our society too of acceptance of transit. You know, it's so easy to drive into the city, but it's getting less easy. The parking lots are full and the volume. And so I'm now getting requests as a rural councillor, well, when are we going to finally do that? And I think we're right on the edge there. I'm in conversations with South Frontenac, and I believe in other areas of Emerson, we want to see transit turnarounds. I believe one is in the works for the north here, and so that will be able to connect to the rural communities to the north. See how that it's like a web that will grow, I believe, and we'll be able to the buses that or carloads that come in from Charlotte Lake, instead of having to go in, maybe there could be a bus, you know, at a turnaround in Glen Burnie or somewhere north of the 401 where it is happening. So I'm excited about what the progress that's been made in that for my area, because everyone's going to come through it. And I think that we're part of the solution, and things are happening there too, because people don't mind getting on the bus now and getting directly to the hospital or something like that, to where you have to go, and or into town for shopping or downtown. So those things are in the works.
Thanks, Gary. Those are good insights. Claire, you had mentioned in a conversation earlier about practitioners. Now, do you find that there is an issue in terms of getting practitioners to rural communities from a transportation standpoint, or vice versa? Is there anything that you wanted to comment on the transportation piece from your experience?
For sure. It's interesting because someone had just brought up in the chat, are we pertaining to transportation of health practitioners or transporting of medicine and supplies? And it's really interesting because from my experience of working with a lot of different practitioners, it's fascinating. And we all have seen the huge paradigm shift of people feeling their mental health has suffered by being in populated areas for whatever, feeling overwhelmed. So they're actually moving to rural areas for their mental health. The irony of it all is that they move to these rural places and they're having a whole nother gambit of other struggles that they're realizing, the accessibility to different things. So we're really in a couple crosshairs of like, okay, I've moved to somewhere rural as a practitioner for my own mental health. And now they're during the pandemic be feeling like I can't leave now. My whole world is now come to me with the rural, my sanctuary where it was supposed to be quiet. And then obviously they're struggling because the internet access, that's the only way that they can provide that support. Something I'm, for those of you that know me, I love technology, and any part of the future and tech I'm on. And I've been reading a lot, speaking to the transportation of medicine and supplies. There's just, I know it went public, the drone delivery. So I'm hoping that's kind of exciting. I'm hoping to see, in real time, the deliveries of supplies are going to be just enhanced. I've worked in the drone industry for a long time, and it's really neat to see that taking off and being able. So I think supplies and medicine will change, getting that. But I think the individuals, I think this is a big question to look at, where we want the mental health of our practitioners. They're getting away, but at the same time, we have these struggles of them transporting. And then obviously the patients trying to go and see them. There is a longer waiting list, and even the stress and anxiety of knowing the commute or whatnot, especially during winter months. So I don't know if I've really provided any solution, but I think it just addressing, that there has been a huge paradigm shift of people moving to rural areas, but then not realizing all the other obstacles that's going to come with going to the rural areas. And I know, Louise, you probably can speak a lot more to seeing that shift, especially from the practitioner side, and same with Meredith.
Thank you. Yeah, and Louise, I'll, if you want to talk in a second, just I wanted to touch base on one of the other questions. There was a comment actually that talked about the virtual video home care available, currently to patients, and has been for a while, but even more so because of COVID. And that, nurse practitioners and doctors may be talking to a patient virtually, but they may not really be seeing what's happening behind the scenes. And, I'm a perfect example. I have a father who's ex-military, who is a very proud man and will not tell a nurse practitioner or his doctor what's really happening. And if it was a video call, you can be guaranteed that they would not see that at all. That also then lends to the transportation issue, because maybe some of these patients who are managing their care from a virtual physician standpoint or a nurse practitioner support standpoint, maybe they don't even have the transportation. So that's something else I think the DDQIC team, should be addressing in their reporting. Is transportation is an issue with regards to the practitioners themselves, with regards to people getting to the city of Kingston for very important care. But what do we do with the residents in the communities of people that don't have vehicles at all? And how do we get care to them, in their local communities, whether it is a library or an ambulance service station, or, again, I'm just throwing these ideas out. So transportation, there's so many different pieces to the transportation piece. And I know as part of the report that they're going to be doing, that'll absolutely be one of those integral topics of gaps and opportunities. Is there any last quick comment on the transportation before I get to my next question? Louise?
I'd love to add just a couple of things. I'll try not to spend too much time. So along with South Frontenac Community Services, the county funds us to deliver a volunteer transportation program. So anybody in the area that does not have transportation, there is access. As Meredith said, there is a cost to it, but some of it's subsidized. So certainly medical rides for ODSP and OW is covered. But seniors rides are also available. And I think a really important point is that I think we need to stop assuming that everybody's going to drive to Kingston for services. And we have an opportunity to bring services up here. And that's really, so the drones are excited to hear, but we spend a lot of time driving people to Kingston every day for dialysis, for methadone clinics. How can we make that different? Do they actually need to go down the 38 corridor every day to go and access services? Some people rurally, we don't think about it, but can't do dialysis at home because we're on well water. So it gets complicated. As Claire pointed, you move north and say, I think I'm going to live a simple rural life. And sometimes simple rural is very complicated. And lastly, I just wanted to add that employment. So what we need to do is use the opportunity. There are jobs out here. There are places to work. We're really lucky to have great services. I know with the family health team in Charlotte Lake and myself, employment is really hard to hire local people. So help spread the word. There are jobs out here. We want to hire local people. We don't need to have people drive from Kingston. We'd like to hire our own. And I think there's a huge employment opportunity out here. We just need to make that connection. So that would save the distance, and we don't have to drive. We can have it here. So
Thanks, Louise. Yes, absolutely. And I think actually Louise and I had a conversation last week where we were saying there are probably healthcare providers that are leaving from rural, driving to Kingston to go to work, and the other healthcare providers driving from downtown Kingston to rural to go to work. Like, there needs to be some communication somehow. So thank you very much. So in light of time, I just wanted to keep on to the next question. Boy, this one again is another big one. So let's be pretty succinct here in terms of the discussion, so that we can help DDQIC and Bruna and Megan, her team, really kind of focus on what those opportunities could be. How could funding affect rural health? Who wants to talk about that in the panel? Or do you want me to start? Anyone?
I think you could start, Tracy. I think you have a lot of insights in this area as well.
So in previous conversations with the group, and then also in previous experience with multiple opportunities and projects that I've worked on in the past, the funding piece is integral. Funding, though, has to be, you have to consider on a funding piece, it's temporary. So when looking at potential business models to provide healthcare in rural communities, we want to make sure it's a sustainable model so that it can self-sustain itself through not just government funding and private funding, but through its own support as well. And again, funding is really important to get projects started, but we also want to make sure that whatever we're doing is sustainable. The other piece with funding is that the more partners involved, the bigger the project, the more money that you can get. So I see this group, the DDQIC team, in this particular panel, and the reports that we're going to get back from Bruna and Megan and her group, there's that we could look at possible funding models as a region, and then look at possible programs that we can help support ourselves through the KFLA area, very large region geographically. I think it was Meredith, you had talked about a 4,400 square kilometers. Well, I think Lennox and Hampton County is about 4,200 square kilometers. Like, there's a massive land piece. Kingston in itself has a massive land piece as well. So I think there's opportunities for us to look at funding. That is definitely one of the roles that I would play in this particular group, where with my new role in the city of Kingston, we could pull together partnerships and apply for funding to help work on projects, whether it's a transportation piece, a communication piece, and some of those other gaps and opportunities that will be addressed. Any other thoughts, comments before I go to the next question?
Something that's, Tracy, I love what you just said. And something that I always see with rural funding is that making sure the money goes into the right hands for the people have the expertise. And I think it's so important that the people that are living and breathing in the trenches of seeing the day-to-day really have a big say on how the money is being spent. Because I don't know about you, but I think sometimes just making sure that once the money does come in is making sure that it's effectively used, especially Louise, you were talking about, cross and pass, like why are we spending the money of someone coming from Kingston up north and vice versa? And I think when we have people in the right, in the trenches that are working with it, that they understand that they're making some big calls on where the money is being spent because they know best.
Tracy, that's a thought. Like, what the comments that are coming in are related to the disparity between wages, at the hospitals and to the north. And I'm wondering if that's the questions we should be asking, just like Claire said, by asking our governments, if we're going to fund things, then let's put it in the right pockets. Let's make sure there's incentive or equalization in a way that, because people are driving in from Charlotte Lake to be nursing in the hospitals here, perhaps. And I know there's a lot of driving, whether it's Westport, and so that's to me an area, and that's the problem we had in broadband. It's poorly allocated funding. There's lower hanging fruit that we can be very successful in that seems to be neglected, and I'd like to see some movement there for sure.
Absolutely.
Tracy,
yes.
Tracy, can I just and one thing I'm noticing in the chat as well, and I'm just going to speak specifically from my experience from working out here as a nurse, is that because of the shortages, then we're having family members that are trying to fill in the pieces. And we're really noticing and experiencing a higher level of caregiver burnout than we've ever seen before. It ricochets absolutely everywhere from, because people are trying to maintain their own households and then they're taking on all of the caregiver responsibilities. It even goes into transportation where people I'm told on a regular basis, I don't want to ask so-and-so to drive me, or I don't want to ask so-and-so to help me, just because they're already tired, they're already busy, they're managing kids at home with schooling, all sorts of things that are going on. And so it really does come down to, I've noticed a number of comments that we need more supports in terms of, say, nurses or PSWs, because then that definitely then goes further down the line to say our resources that are available. If we have a palliative nurse practitioner, we could keep someone in the home, but in order to support her, we need the nurses, we need the PSWs in order to offer that support. So we are having people leave home and go into long-term care homes or other facilities simply because we don't have enough resources and due to burnout.
Yeah. And that's why we're together today and hopefully going to be moving forward. So thank you. Those are really good comments and some good wrap up. I'm as you guys are talking, I'm also looking at some of the comments as well. If we don't address any of those questions in the chat box, please know that we will get to them after this as well, and we'll get back to you. So the last question of this first round of questions is, what are the advantages to rural health that the panel sees that are underutilized that we could look at and address? So what are the advantages to rural health that are underutilized. Does anybody want to talk about that? Underutilized advantages in rural.
I don't know if it's an advantage, but we've done really well accessing paramedics. So you position paramedics up here and they're not always needed all the time unless they're stuck in a hospital. But if we can keep them away, they are a really great mobile access point. So I believe they delivered some of the vaccines. We were doing wellness clinics. We were doing sessions up here, and they would come, and if we did a monthly diners program, they would come and they would check in with all of the people who were there. They checked their blood pressure. They talked to them about new meds, and they actually kind of preeminently identified issues that would be there. So who else can kind of do those services? So again, I think what we need to do is stop having a model that drives everybody from a city here. And I think the family health team and Dr. Bell is a prime example. They've been leaders in having dietitians and services up here. Dr. Bell is still doing testing in the parking lot so people can just drive there. Otherwise, we were driving down to Kingston to have our testing done for COVID. Those are really innovative models, and the system needs to build it in. And when you're applying for money, and you're serving rural, if you don't have a transportation budget in it, you're not serving rural people. So that would be a really good funding in that you have to add a rural transportation budget one way or another.
I like that.
Louise, you are a powerhouse of you have the lens, really. That's amazing to hear that. I mean, the innovation that is possible. I mean, COVID's going to expose this too, right? COVID has exposed it. A lot of really great success stories. And I think that if we don't learn from them and even heighten them post-COVID or from even now, whatever we're in an endemic, So I just think that you hit on the paramedics, and, part of that wellness checks and being there, just lowers the stress level of a community, knowing you have that resource. And so health springs from that. So well said, Louise. Hopefully we can really tap into this stuff. Thank you.
Thank you. Yeah, absolutely. Saying my words as well. So Bruna and Megan, is there anything that we want to address from the attendees that we're missing at this point? I'm not really seeing anything. I just want to make sure we're not missing anybody.
No worries. We do have a lot of comments. Dan did just ask a question. We wanted to address that question. The rest are comments if we want to add to them in any way.
Okay. I think we're touching upon most of them. Some are just kind of affirmations. We have a new message. Compassionate community. Yeah, I mean, I think we're okay on that. And if anybody doesn't feel like we're addressing their comments or questions, please retype it in, and we'll be sure to get back to it.
Dan did just ask a question to the panelists. He's asking, where are gathering places in the communities? Are there ways that these event spaces could be utilized?
I'm happy to answer. Rural Frontenac has always used all of our great community halls. So if you look at the evolution of a rural community, they started with little tiny hamlets, and they were actually their own municipality. So most of them have a library space, they have fire halls, but they just have community halls. So they're all available. They rent them because someone has to pay for their upkeep, but they really are an amazing rural resource. We don't have community centers. We don't have rec centers. We don't have swimming pools. We have one arena, but we do have lots of little halls in really small areas. And we've been delivering events there. Unfortunately, with COVID, the halls are the first to shut down. And I think, as Gary said, one lesson learned is when we lose those halls, we really create greater isolation for people. So we need to make our best efforts to continue to provide it. We have an innovative program called SALT, Seniors and Law Enforcement Together, that's been running now, and they use all the community halls. They've been going from Snow Road to Ampa to Arden and really capturing the small groups. So if we can continue that, that addresses a lot of those questions.
Okay, thank you very much. I think I'll continue with our next round of questions. Again, we're going to look at about 5 minutes for each question and try to wrap things up kind of based on those original two comments that I brought up at the beginning. wrapping it up in terms of how we support rural health, what is rural health, and, the biggest challenge in rural health. So what I'm hearing so far, the biggest challenge is, we're looking at a few funnels, transportation, funding, communication. Those are three really big things at this point. So my first question is, what resources do we have? And Louise, you've been and actually Meredith as well, both of you have shown so many resources, my goodness. What resources do we have and what support do we need to assist entrepreneurs and businesses to look at innovative ways and make their businesses ready for rural communities? So how do we help? What are the resources that we have currently that we can help entrepreneurs who are looking at supporting rural health? Are there things that we're missing, products or services that we're missing that can support rural health in our existing ways that we can then look and talk to entrepreneurs and budding entrepreneurs to help them create businesses that may support some of those gaps and opportunities? Does anybody
say, Tracy, that from my view, I've had the privilege of serving on economic development from the beginning as well. Certainly have always, actually, I remember years before I actually applied to be on there. So it's something that really is important to me, and I am a small businessman. And I would say, I would say that people don't use the resources, or maybe they're not aware of it. But I think that's changing. I mean, now that we have people like Claire there and Shelley, we have some really talented people in our economic development team, innovation. I'm just talking about here, but that model really is successful. The COVID has really exposed our dependency almost on each other. We have an interdependency, I think, now that's been, to me, more exposed than ever before. And so when our council, we came up with a fund of $1 million to develop business or to support businesses that are struggling. Well, now, and we're seeing funding coming through for Main Street, it's called. And I think that's going to help the small towns. So as well, like Sydenham and Harrowsmith and Charlotte Lake, I believe. And so these are really good ways that entrepreneurs can connect into that. I'm an entrepreneur and I live and breathe it. Okay, I feel like I start a business again tomorrow. It's just, but you want to do is be authentically connected and see where your resources are, and it is there. I think that's why I talk to many young businesses, and the resources are there, and the training, kind of the mindset that you need to access it.
Thank you very much, Carrie. So I wanted to make a comment about Ann Pritchard. She had put a comment in the side box, and Ann works she's the executive director for the Frontex CFDC, which is an amazing funding organization for rural communities. And, I think there's some huge opportunities for us to be, working with Ann down the road in terms of possible entrepreneurs looking to start businesses in health and support businesses in that regard. So if anybody wants to, I noticed there was a hand raised. If there is a question, if you can just put the question on the side. My only concern would be is that if we start having the attendees in discussion, and no disrespect, it would take up too much of the time. So if anybody does have a question or a comment, just please put it on the side and we will absolutely address it. So the second question I was going to bring up then is, what is the best way for businesses and entrepreneurs to connect with rural healthcare providers? So what is the best way for businesses and entrepreneurs to connect with rural healthcare providers to work on opportunities for innovation? So how do we help businesses and entrepreneurs collaborate with healthcare providers, whether it's our rural clinics and our rural healthcare providers, whether it's our municipalities, whether it's actually the City of Kingston and Kingston Health Science Center? To the panel, what do we think is some great ways that we can be connecting business and entrepreneurs to our rural healthcare providers?
So I have some experience with the family health team. They've been extremely innovative. I keep bragging about them, but they've brought out the Gale and I Institute. They're looking at hearing programs. So work with the local providers and see if there's space available, or maybe we need to make our family health teams or family health organizations with the capacity to bring up service providers to deliver the service in our community. So you've got Northbrook, Charlotte Lake, Sydenham, maybe there's opportunities, Tamworth, to bring those service providers and give them space. They don't have to get a whole office and all the infrastructure. And as they innovate and do virtual, they can come up here and use our space to meet and connect with people.
That's
also
great.
to jump in to this question, the last question, and I know Donna was going to speak to a lot of the different services that are provided by Kingston Economic Development Corporation, but something that I've noticed, again, Gary had mentioned not knowing what's available. I think that's a big thing, especially more in the private sector. A lot of the entrepreneurs I work with are actually in are health practitioners in different ways, all different services that they provide, but there is a lack of marketing. People do not know that they exist. We see one side, there's a burnout on one side, and then there's an entire other bunch of clients that I work with that can't seem to get work. They can't just seem to find clients. And I think it's because naturally a lot of the entrepreneurs in that space are not born salespeople. They don't know how to sell or market what they do offer. So it does take someone, this has been something I'm passionate about, is actually selling other people's services and being like, did you know that they do this? And sometimes, obviously we were talking earlier about they do need to commute for cancer treatment and whatnot, but a lot of the time it's burnout, and having someone to talk to, someone to direct them, give them a plan, not feeling so isolated. And there's a lot of providers that are available. And I think it's just having a universal or a centralized database of accessibility for people to know that there are these people. And I think as we see, or in every capacity, is everything's being siloed in different ways. But I think Kingston ECDev, we've been working really hard to try and do that outreach. And I see huge changes. But again, I think it's just letting people know that these services, and Gary, I know you had spoken about that, is that there's just the healthcare entrepreneurs, I would say, are not the biggest, they're not huge in sales and marketing. And we need those people to be, and those are the supports that we need to be putting in, is that we need to have champions for the support that they do.
Good point, Claire. No, that's really good, very valid points. And we do have, a lot of great partners, such as Kingston Economic Development and, the Frontex, CFPC, Kingston Health Science Centers. We have, all our municipalities. So there's amazing partners and resources that everybody can be looking towards and working together with. And that's why you're all here, and that's why we're all talking, so that we can keep this conversation going. So one of the comments in one of the questions that I was going to talk about was about the priorities in rural health. And as I'm listening to everybody talking and kind of hearing some of the comments that are coming out of the questions, I'd like to maybe clarify, just to help the DDQIC group and team with their reporting and help them with the tools and resources they need. So I'm hearing from the panel in the discussions that we're having, the priorities are communication, whether it's communication from a broadband standpoint, whether it's communication from accessibility to tablets and computers for people in rural communities, whether it's even communication to offer information about resources to them. The second piece I hear is transportation. So transportation can be people not having access to vehicles to get to their healthcare needs, whether it's in the city of Kingston or other. Actual practitioners and staff not being able to get to work or get to their jobs to support health needs and healthcare. Part of that transportation also, I think, also kind of wraps around the housing component, where a lot of families are wanting their elderly family members to stay at home, and how do we get the care to them at home? The other piece is housing in general. So, how do we find, that's just another topic in itself, but making sure we find housing for people with healthcare needs in rural communities so that they're taken care of too. And then The other piece then is kind of to wrap those three pieces up is really, the funding. So how do we work with our partners and all of you and our regional partners and our municipalities in the KFLA region to help support our residents, our practitioners, our employees, our employers, and new businesses and entrepreneurs to help create programs and opportunities and businesses to support rural health and bring more opportunities to get rural health to the people that need it. Bruna, did you want to interject on anything? I think we're covering quite a bit. I do see a question here. What groups, people, orgs in your communities are the natural communicators? Are there informal structures? So what groups or people, organizations in your communities are the natural communicators? Are there informal structures to tie into? That's a really great question. Does anybody on the panel want to bring that up?
Sorry, I feel like I'm intruded, but social media is huge. And so when we post something on our Facebook page, we post it in about 12 different sites. So there are lots of people who've discovered that the internet's great. And I'll go back to Frontenac News. It's, you got to read Frontenac News to find out what's happening. So it's continually away. But social media, I would say for younger people is just huge. And I think my question on all of this is we can't use an urban lens to understand rural communities. So think outside the box. So I'm going to give you an example. There were people who were stuck in beds and couldn't be released from hospital because they needed a lift. And the LIN with community partners discovered that if they got a mobile lift and they actually went around in the van and lifted people, they could save so much money by just doing that and probably meet the needs of the person who needed the lift out of the bed, who wanted to be at home and certainly didn't want to be sitting in a hospital. But that's the innovation that if you don't think really outside it, that how can somebody do this differently as opposed to trying to build on what we do and stretch it into a rural concept. So I think innovation is the right word for this conversation. We have to think differently about the issues and the solutions.
Yeah, good point. There was another comment as well, rural areas needing physical facilities that can accommodate the services in addition to primary care. So in some of the conversations that the panelists and I and DDQIC team had previously in the past few weeks was facilities that are available currently that we can support with healthcare providers, whether it's, as Louise was mentioning, emergency care centers like ambulatory care and paramedics and even libraries and halls. But also, is there a way that we can be looking at remote opportunities for people in communities to have access? So is it, and I'm simplifying this, but is it something like a van that has, a satellite with some computer in it that can actually get to residents, whether it's at a local community hall or it's in a group setting where they can access doctor care and physician care and public health care to address their needs so that we're not having to worry about transportation in that regard. So there's so many pieces that we can touch upon with regards to this. One of the comments too is how do innovation projects partner with health organizations to provide rural health? And that again is part of what this DDQIC project is about, is trying to see where those gaps and opportunities are and those key pieces that we've been talking about the past hour and a half, and how do we look at those and then create innovative opportunities, potentially new businesses and entrepreneurs, but also work with our existing partners to help everybody working together to fill in those gaps and voids. That is really why we're all here together today, to make that happen and to have this conversation with all of you. And gosh, we've had quite a few of you in the call and with us today. So why don't we leave a minute or so if anybody in the panel wants to address it. And Gary, go ahead. And then if anybody, sorry, Gary, just one sec. Any of the attendees while Gary is talking want to provide some last minute comments or questions, please do on the side and we'll make sure to address them before the end. Go ahead, Gary.
Yeah, thank you. No, that's excellent. I see that Mr. Bell mentions, physical facilities that can accommodate. I'll just share a little bit what I know about in Kingston. One of the new things is that we're with the planning department. They're doing a major work on official plan review and zoning bylaw reviews. And it's really, and so I'm fortunate to have some involvement or at least conversations on that. And where I'm going with that is like one of the areas that we didn't really mention, well, there are faith communities and service groups that have buildings and structures. And one of the initiatives of in Kingston is that we want to create pathways in land planning and allow that where there are ways and means to use these buildings for more purposes. And this is really good because we do actually have buildings that could be used for other reasons, like it could be some clinics, could be meet and greet, or when there's a disaster or something, and kitchens can be refurbished and allowing. So there are things that we're doing that might be modeled in other areas, or we could actually share some of that, what's happening. And I know that the planning department is on that, and I'm excited to be aware of it and know that we can escort that through a little bit, where that's been the frustration in the past. So that's the exciting thing for me that I want to share, is that from 2017 or 18 on, I've seen an evolution of successes in transportation, economic development, in broadband, and also in housing and that. So I do see things moving, but I think it's quickened by COVID. And now we've at a point like this that, this is a real important time that I appreciate being here with you guys, because I think that we're on the precipice with the right people to hear of our successes and just really launch them well, and looking at all the possible positive changes.
Absolutely, Gary. Claire, I'll just be 1 sec. I just wanted to comment on something that was brought up on the side. So one of the comments is a group of qualified people that are being underutilized, nurse practitioners, newcomers that were qualified in their home country. Might we think of incorporating these professionals in our community? So there are many amazing examples across the country, and that have been taking advantage of very qualified individuals who are coming to Canada to live, that are having difficulties qualifying and getting their licensing changed to the Canadian format. So we have another member in our team as well, and also with the Kingston Economic Development Group. I think there are ways that we can be looking at resources and other projects that have actually been very successful in other parts of the country, that we can be taking advantage of that. So that's a very good point. And I just want to remind everybody that all of the comments and questions that you've put on the side in the chat, they are going to be addressed in a report, and we will absolutely make sure that they're part of the conversation, and we will get back to you on that as well. So go ahead, Claire, you had something to say.
I just was reiterating, Gary, I think you've touched on some things, and I think from an entrepreneurial lens, I think it is at the point where we should be really celebrating this, the movement that has gone. I think there's been a mass exodus of people from very heavily populated areas to smaller communities that bring a whole new set of skill sets, whether it's technology or even just they have expectations. And so I think when they are moving to these places, I'm noticing a lot of people, especially my sister's a fly-in nurse, and she's seeing a lot of people flying into, moving into different places, and they've come from populated areas and they have new expectations. And I think they are now part of the solution, which is fantastic to see a lot of people moving and bringing new expertise to these areas. So I think it is there is a lot of optimism from the entrepreneurial side of seeing new skill sets moving into and with the rural talent, and people from highly populated areas are sharing and they're working together. So I'm hoping that we continue to see this. And I think COVID, as hard as it's been on everyone, there are some definite advantages about seeing the movement of talent through rural communities.
Yes, absolutely. Thank you, Claire. No, that's a good point.
Tracy?
Yes.
Sorry, can I just say that from my perspective, when I'm out in the community and I'm seeing people, I really do get a lot of feedback from individuals that live out in the rural area, that they're so appreciative when we offer things out here, that they haven't had to drive. Just a couple of examples of that is, it's hard because sometimes you'll hear, it's all right, they can just drive into Kingston or they can just drive. But, a 35-minute drive is not always easy to do. So little things like if we offer a mass flu shot clinic out here that's organized, we hear many times, just thank you for doing this. We didn't have to drive, a great distance in order to do this. And one thing I just want to point out is that rurally, what I notice is that it never hurts to ask. It's amazing the partnerships that are out here. It's amazing that when we step forward and we ask if we can utilize a resource or if we want to work together. I know one example of that would be Stone Mills did it before we did it here in South Frontenac, was a mass drive-through COVID vaccine clinic where they collaborated with the township, and the township got involved and helped them out. And then I went to our township here, and then next thing you know, we're using our big garage base here and running clinics. And then we used to use the church in Harrowsmith, the Free Methodist Church over there, for our flu shot clinics, but due to COVID and having to space and keep it outdoors, we then moved to the township. So it never hurts to ask. I feel like the resources, we have great resources, and like Louise says, we have to be creative, and we have and asking, you just never know, great things happen.
No, absolutely. And I think I think really at the end of the day, everybody really wants to help each other. It's just, we have to figure out how that's going to best be effective and widespread as possible. Mr. McClellan, you wanted to bring some comments from DDQIC?
Well, I mean, I haven't had a chance to talk about it with the DDQIC team, but they know me, then that doesn't, I always like floating out ideas. So Chloe and I and the DDQIC team have been involved in a different initiative, which is the Community Opportunities Lab with City of Kingston, looking at food security and food sovereignty, and working with Joe Reynolds and with and a number of the different stakeholders and groups. And so things like the community farm, we've been involved in some of the discussions about the initiative at Harbour and so forth. And so what we did to get that together, both to, because I mean, as various people have pointed out, I think understanding the problem, the whole sort of design thinking approach of observation, insight leading to empathy, and better understanding, working with all the people, in the rural regions, to identify, I think this discussion has already highlighted that, right? I mean, we've seen transportation and communication, this notion of, that sort of notion of decentralized. And I think, building on the point that Dan made as well, embeddedness, right? It's always tempted to say, well, we can sort of make links from where we are here. But I'm saying, of course, I'm in the West End of Kingston, but I think, how might we capture that embeddedness and that kind of thing, and make effective use both of the physical infrastructure, but also the people that are there closer to the communities. Anyway, long and the short of it is, I'd like to suggest for next steps that we might initiate a design and systems thinking workshop, or a series of workshops. I'd like to propose that, and so obviously what's happening with the pandemic will be important, but I'd like to propose that we find a place, for example, in Charlotte Lake, perhaps, to host that. And what I'd also like to do is to, some of the tools that actually get used in the design thinking approach are things like photojournals, interviews. Essentially what you're doing is you're gaining people's lived experiences. And that's elderly living alone, that's practitioners, etc. But I think that this would be an ideal approach to do that. Build the community. We can also then start using a systems mapping approach as well to now better build a shared understanding of what this looks like. I will happily volunteer to contribute to that, and happily volunteer to facilitate that, if that be people's interests. And what I would suggest is, we could maybe have a goal to mobilize as next steps, perhaps in sort of later February, but it'll be that balance between, what we can all accomplish, given the time constraints that we have, but we don't want to let this languish too much. I've been really excited by this conversation, and I've really insightful observations. So there, I want to put that on the table.
Jim, that is amazing. And I think that's kind of what Bruna and Megan are going, well, that was okay, a real quick wrap up. No, and I think really, if I'm going to speak on behalf of the panelists, just because I've talked to you guys before. I mean, I think this is what we're looking for. We're looking to have a conversation, see where these gaps and opportunities are, what are some of those key pieces that we can be looking at and addressing together, regionally, all together, support, the resources that we have, say maybe at the city level, and bring them out, to our regional partners and our rural communities. Absolutely a report from Bruna, Megan, and the team, in terms of what happened today. I've noticed, some really great comments. Bruna, I don't know how you want to, there's some really great comments. I'd love to do some engagement as well with some of the people that are making great comments. How do we do that? What are your recommendations moving forward? And Jim, yes, please, you're on. You've volunteered. You've got 50 people here looking at it. You're not out of this now, so I'll hold you to it. I live down the street.
Yeah, no, she knows where I live. No, I think that part of this will be, what will be really helpful is, the more people that we can, many hands make lighter work. It's not going to be light work, but many hands make lighter work. And of course, many hands are important to ensure that, all of the perspectives, both professional and lived experiences get incorporated into this as we build this out. Dan, thank you very much for your offer and people that are nodding and everything else. I know some colleagues from Queens, for example, and who we've looked at some collaborations on as well, especially related more to rural health too. And it would be great to try to identify some projects. A key thing I'd love to put out, though, I think and I offer this as, we're always looking for ways to have a positive impact in the region and also provide impactful opportunities for our students. But I think a really critical thing I want to put out on the table is it's going to be really important to see how we might work in support of communities in those regions, right? Embeddedness. I think the embeddedness is going to be a really critical thing. Embeddedness and building localized capacity that absolutely, again, can be part of an interconnected network. But I think that's where sometimes initiatives might fall down in the past. Is this just, and I think this point has come out in some of the conversations, right, that have come out, is that if what you're sort of doing is linking back to where that concentration is further, in one sense, yes, you are providing access, but as people have noted, it's a long way away, et cetera. Embeddedness, building embedded capacity, I think will be a very, really important sort of, and I would offer as a sort of fundamental design parameter as we go forward. So there.
Thank you. You're on. Bruna, so next steps, what do you want from us? How do we engage this amazing group of attendees moving forward? Because there are some things that we haven't addressed necessarily, but I'll let you do the end.
No, for sure. Yeah. Thank you everyone for all your comments and questions. If you feel like there's, if any panelists feel like there's any comments in the chat right now that you'd want to provide some insight to, you can just pause me. If not, we will be debriefing with the panelists and putting together a report and also sharing the recorded video of this session, like Tracy has mentioned. So we really just would like to thank everyone for attending today. It's been so incredible to hear all the insights and see all this involvement and this, want to work in this community and take advantage of the opportunities that we can. Keep on the lookout for any further sessions on this topic, as we will try to develop some workshops like Jim mentioned, to really try to explore all the opportunities in rural health in the KFL&A region. We do want to say that, our Build to Scale program, our health innovation program, which runs from May to August, applications are now open. It's a flexible part-time accelerator program where entrepreneurial teams who are responding to unmet needs in the health sector can apply, and early stage ideas are welcome. And we really would like to see some ideas related to rural health. So applications close on February 20th. And that's all I have to say. Thank you very much. If any of the panelists have any final words, feel free to share as well. Thank you so much, everyone.
And thank you to our panelists and all the attendees. Have a great day.
Yes, please.
Yes.
I am, on behalf of both DDQIC and the Health Innovation YGK Initiative, and also on behalf of all of us here, I'd like to thank our panelists, and Tracy for a wonderful job moderating. I told you you do a better job than me. So wonderful job. And I'd like to thank the DDQIC team, and particularly Bruna and Megan, for doing a wonderful job in organizing this. I've been involved in this initiative from the start. This exceeded certainly my hopes, and this is really exciting to see. So let's keep going. The ball's rolling.
Have a great day.